everyone. Today we will be discussing one of the very important topic regarding interpreting your blood work. In this live session, our goal is to simplify complicated healthcare information and make it more useful so that it makes sense to you. These days, because of New Year, everybody is going through physical routine blood work. So I thought it's more appropriate at this time if we could create a video where we share with you and explain you the common blood test which we normally interpret, and that way you are not having any issues with knowing what your doctor is trying to do. So let's start this video of on explaining your blood test, a step by step complete guide. See, whenever you go to blood work, the goal here is that you want to understand chemically how your organ systems are working, and also you want to know what are the things you potentially may develop in future, and third is come up with a practical plan how to prevent it. So this blood work is not just a simple blood work. It has a purpose and meaning of knowing you as a chemistry lab. Human body is the most complex system or a machine ever created, and the intricacies are so huge. Just to give you an analogy, our body is made up of trillions of cells, and in each cell there is about 10,000 chemical reactions happen per minute. Trillions of cell, 10,000 chemical reactions in each individual cells per minute. And that makes this lab the most extraordinary and most precisely controlled. And whenever you do the blood work, we are just taking a snapshot at a very macro level from head to toe what's going on. With this background, we will explore different tests which most of the time you get it done. Whether you are getting the blood work done for your preventive care or management of your chronic medical problems, or you have any other reason out of curiosity you want to get a blood work, these are the most commonly done blood work. We have started a series of videos where we will dive deep into each of these tests. But today in live session, once we get done, you will have a comprehensive view about most commonly ordered blood tests. And next week, we will discuss all the radiological tests and other parts of normal testing which gets done in each office. Whenever you go and get a blood work, you have first test is complete blood count, we call it CBC. Second test is CMP or comprehensive metabolic profile. Then is the lipid profile, thyroid profile, hemoglobin A1C. Then we check two very important vitamin B12 and folic acid for your brain and nerves, and vitamin D for your bone health, PSA in case of males, and the urine test. This predominantly, this profile, which I have alluded in this slide, covers about 95% of the time you will get the blood work. So let's understand. First test is CBC. CBC is a test, we call it as comprehensive blood panel. And on CBC, we check everything about your blood count. What is blood? Blood is a fluid which is predominantly water, and it has two main components. One is the cells and other is the electrolytes and proteins. So combination of water, all proteins, chemicals, electrolytes, plus the cells, that is the blood, which is lifeline of us, which is circulating in our system. If you take the cells out of your blood, we call it serum. So when we do the other kind of test other than the CBC, we basically dealing with the serum. If you take the cells out of this fluid, you're left with water, chemicals, and proteins, and different kind of other things which we will discuss, hormones, enzymes, which we'll discuss as we explore further testing. But in this test, we are talking about only cells. In your blood, there are three series of cells which you have. First is the red blood cells. That's what we know the blood for. Every time we have a cut and bruise, you see the redness. If when you have the blood drawn in our offices, when you're drawing those tubes, and those tubes is always red. This redness coming from the red blood cells. So that's the first kind. Second is the white blood cell, which you don't see it. That is our hidden army. That is really like a liquid army which is always there 24-hour basis working on our behalf, protecting us from internal pathogens and external pathogens. And third is your platelets, which are medics, which are constantly going to the places where there's bloodshed, cut and bruises, making blood clot, busting them, and continuously keeping the system repaired and our circulation going properly. So whenever we look at the CBC, look through the lens of the our red blood cells, white blood cells, and platelets. First is red blood cells. Red blood cells are numerous in number, but I will keep my goal here is to provide you not a in focus or a detailed view about each indices and markers. In this live session, my goal here is to provide you all the different overview, and then we have already videos posted on YouTube where you could dive deep into individual tests. Red blood cell, when we're looking into two parameters. Number one, what what is the number of red blood cells, which is called RBC cell count. And second is the how much is the hemoglobin, which is inside the each red blood cell. Hemoglobin is the one which carries oxygen from your lungs, transported that oxygen to every cell in the body and bring back the byproduct carbon dioxide, and which is gets expelled out of our lungs. If we have low hemoglobin, this means your lifeline is weak. You will be feeling very weak. You will be feeling very tired. Second part is the cell itself. How many cells are there? If the cell count is low, you will have a problem. If there is cells which are defective, you will have the problems. So this when we talk about red blood cells, for your purposes, 99% of the time, you are interested in hemoglobin, red blood cells, and then also certain parameters which your doctor will go over, which means how much individual red blood cells is, and that your doctor can check and can evaluate whether there is a problem with the number or the morphology of the cells, whether you have behind those abnormalities, what are the changes which might be happening, whether you have a B12 deficiency, iron deficiency, folic acid deficiency, or a bone marrow deficiencies. Second class of On the blood CBC we check is the white blood cells. White blood cells is your liquid army, and they have five subcategories in. First is the neutrophils. If we look at from the analogy of white cell counts being the liquid army, your neutrophils is your artillery. They are the frontline infantry which goes first. Whenever there is any kind of infection, inflammation, they go to the scene first and they start the protecting you, start fighting on your behalf. Lymphocyte, and they are the most predominant. They are about 60% of your total white cell count. Second is your lymphocytes. Lymphocytes is your intelligence units. Lymphocytes are of three kinds. The first is the T lymphocytes. They are the one which are the kind of the control and command center. They control both kind of your immunity, the cell mediated immunity and the antibodies which your body makes. That's the B lymphocytes, which is the second class. But that you need T cells to have your B cell produce the antibodies and neutralize a lot of bacteria, viruses, fungi, and other pathogens. Third is the NK cells. Those are the independent commando units, and those NK cells are the one, they are scavenger. They are running around in your blood whenever they see any threat, whether it's abnormal, your own cells, which sometimes could be atypical cells or cancer cells, viruses, any kind of thing which does not belong to our body. They will engulf them, destroy them. They are the one which are very, very important. Remember when we talk about stress and the very when we don't sleep well, we are anxious all the time. That is the NK cell goes down. And people who meditate, they have very high level of NK cells or the commando units which are circulating in your blood. So we will tie up in the end how our lifestyle can affect a different kind of chemistry or cells in our body. So take lymphocytes. If a neutrophil is your infantry, lymphocyte is your intelligence unit, which coordinates the function of different kind of T lymphocytes. Eosinophils is your alarm system. Whenever there is allergies, there are going on, or parasitic infections, they go up, they kind of create, they are specialized for allergies and parasitic infections. Monocytes is your heavy artillery. What they do is they are big cells. Whenever they go, they follow neutrophils, and there are chemicals which guides their movement, but the monocytes are the one which go there and engulf all the inflammatory debris and destroy it and clean up our bodies. They are the heavy artillery. They are the heavy this thing. Monocytes, when they reach a particular organ system, they change depending on whether these monocytes reach our cells, the skin cells, or our bones, or any organ system they reach, and they change accordingly. And they have many different names. Monocytes gets converted to macrophages, Cooper cells, glial cells in the brain. So they are the one, they are heavy, ready to fight, and whenever they reach in a specific place, they can change accordingly. Then the basophils are the one which are constantly navigating. They produce chemicals, which is histamine, and that can lead to multiple problems. They control a lot of allergic and chemical reactions. Third class of cells are the platelets. These are the medics of our system. Their goal here is these cells, they become, whenever they cut and bruise, there is some receptors gets released, they stick to them, they become sticky, and they plugs leaks. Like whenever we have cut and bruise, we make a blood clot. These are the cells which starts that plugging process in the beginning, and then there are proteins which are circulating in the blood when we cover liver, well, I'll explain it to you. And these platelets and the proteins made by the liver, they make a blood clot. At the same time, there is another system in the body which blocks these. The, when we don't need the clots, they destroy the clot and have the smooth lining of our blood vessels and stuff. If you have any heart problems or anything, then that's the time. Remember, we give you aspirin. We give this aspirin to nullify these platelets so that they don't become sticky and they don't make a clot or plaques inside our blood vessels where our nature works against us. So blood is made up of liquid part and the cellular part, and the cellular part is your red blood cells, which is your lifeline, white blood cells, which is your army, and the platelets is your medics. Then when we do the CBC test under the microscope, these days computers do this job. We could understand individual details of your red blood cell, white cell count, and platelet, which indicates if there is a problem in production in bone marrow or there is some nutritional deficiencies and some kind. If you have a blood cancer or anything, we could test lot of these tests. CBC gives a lot of information. It now this blood is is made in your bone marrow. So in turn, it does not only it give you how your bone marrow is working, how your nutritional status is, and also these cells gets destroyed in the gland which is called spleen, and it also tell you functions of your liver. So these things are very intricately involved, but the purpose of this live session is to keep these things simple and give you general overview so that there is no problems. Whenever you have second component, when we do the blood part of the serum, the liquid part of the blood test, there is we first test we call comprehensive metabolic profile, and we test four things on that. First is the electrolytes. Second is the kidney function test. Then is the liver test and uric acid. Let's take up electrolytes. There are about five electrolytes which I will go over in this session. The first is your sodium, potassium, chloride, bicarbonate, calcium. Sodium level is basically tells the status of your fluid balance in the body. If your sodium is going up, that means you are getting your volume of blood is low. If the sodium level is low, this means you have more blood, more water in your body. Consider your body as a water tank. We are 80% water in which there is salt. So if you have more water and the salt is less, your sodium level will go down. If your tank loses water and it doesn't lose sodium with it, then the sodium level will go up. When the sodium goes up, we call it hypernatremia. That is usually a sign of water loss. And when the sodium goes down, this means you have more water than salt in the body. And remember, each cell is bathed in this liquid. If there is a change in the tonicity or the electrolytes in this liquid, the cells, the water across the cells, each cell has to maintain its integrity. If the water outside the cell is high, it will try to get into your cell and make your cells swell up. And depending on which organ you're talking about, you will have symptoms. Let's most feared one is brain because brain is a closed cavity. Just imagine a situation where your sodium level is low, your cells, brain cells swell up. When the brain cells swell up in a closed cavity, initially you will feel weird, weak, and tired. You could have change in mentation. Then you could have seizures and ultimately death. These electrolytes are very important. Same way when they are dehydration, the cells shrink in size and they cannot function. And I'm keeping just using brain as an example, but that will happen in every cell in the body. Second electrolyte is your potassium. Potassium, as sodium is outside in the outside of your cells, potassium is inside the cell. And the shift from sodium being inside the cell to outside is controlled by sodium potassium pump. Nature has made very beautiful mechanisms to control how much concentration of each electrolyte will be. So if there is a problem with that pump, which is driven by multiple stimuli, you will have problem with the potassium. Potassium primarily gets into the body through our food, and it gets primarily excreted through the kidneys. If there is any problem with the kidneys, your sodium level will go up. Sodium is the one, and your potassium level will go up. And the potassium is involved in the generation of action potential or electrical activity in different cells so that they could transmit the information. And most important is your nerves and brain cells again, and your heart cells, because heart cells and nerve cells are very sensitive to your potassium level. So high potassium is called hyperkalemia, low potassium is called hypokalemia. They both are bad. They should not be ignored. Third electrolyte we check is the chloride. Chloride is easy to understand. Wherever sodium goes, that's the same direction it will go with the in that. If the sodium is going up, chloride will go up, and if the chloride is sodium is going down, the chloride will go down. Fourth is carbon dioxide or CO2 in your blood. That is your acid base balance. Remember, we every kind of food which we eat either is a neutral, alkaline, or acidic. Most of the protein diets which we have like these days, there's a fad of keto diet. Keto diet, all the proteins are primarily are acids. So your body has to come up with a buffer system, and this CO2 or bicarbonate is very important. That's why people who are on a very, very high protein diet for long term, they have a lot of consequences on the acid base balance, brittle bones, and that's a talk in itself. But for us to understand the CO2 part of the electrolyte is your acid base balance. And next is the calcium. The calcium is tied down with the strength of your bones. Like your bones, whenever you have an X-ray, the white part, that's calcium. But calcium is not only is in the bones, the calcium is also found in 300 enzymatic and chemical reactions in your body. These are very, very intricately controlled and intricately regulated electrolytes. Calcium, when it goes up, we call hypercalcemia. And when they go down, it's called hypokalemia. Next test part of your CMP is kidney function test. On kidney function test, basically, kidney is the organ which filters your blood. The test which we used to go by was this BUN and creatinine. But what happened is over the period of time, this creatinine is turned out to be not a very good test to give us insight into functioning capability of your kidneys. These days we use another test we call EGFR, which is a calculation which is driven from your these indices. This EGFR you will hear, and we get a lot of questions as a physician because since the EGFR has been introduced, I have gotten more calls from patients asking for EGFR because when they suddenly see their record, They will say stage 2 kidney disease, stage 3 kidney disease, and I want to explain that in detail. As I said, creatinine, if when you move, if you see the creatinine is normal is zero point 0.7 to 1.4. If it goes from 1.4 to 1.6, it doesn't look like much, but you might have lost 20 to 30% of the function. So we go with EGFR now. That means is when your kidneys are perfect, your baby, your kidney functions but filters about 120 ml, 120 to 25 ml of blood per minute. As we go through circle of life, there is a some functional decline in the function of the kidneys. So if your function is between 120, go by 30 point to 90, we call stage 1 kidney disease. From 90 to 60 is stage 2. From 60 to 30 is stage 3 disease. And that stage 3 is divided between A and B. But for this discussion, we will keep it that 16 between 60 to 30 is the stage 3. And that is where you will find most of the seniors will find stage 3A or stage 3B kidney disease. I want to make sure you understand that does not mean kidney failure. That means your kidneys ability to filter is going down. You should not put any over the counter medication, because what we see is the most common is people have a habit of taking ibuprofen, naproxen, goody powders, and sometimes people use a lot of aspirin. If your physician is telling you you have a stage 3 or 4 or any other above, anything above 3, make sure you ask your physician. And also you should let your specialist and other physician know that you do have a stage 3 kidney disease. But that is not mean you have a kidney failure, because that is where I have seen a lot of emotional reaction are happening in the patients. Next test is if they goes from 30 to 15 is stage 4, and then anything less than 15 you will end up on dialysis. These are the normal values which I have described you: sodium, potassium, chloride. Uric acid is one of the tests which we do it for gout, and that is also worth mentioning. We don't do these like uric acid all the time unless you have propensity to develop a gout. Further, there are other electrolytes, magnesium, selenium, zinc, those can be tested, but most of the time their function is very limited unless you are on certain medications for heart failure and other, where we believe we must check it, but they are not part of your normal, because normal testing. So they are not they don't add any extra information unless you have a reason for those electrolytes to go down. I've seen a lot of YouTube videos and I've seen a lot of people going to specialized clinics and getting these tests done, but I do not believe that helps. Next component of CMP is your liver function test. Liver is the most important organ. See, our my experience dictate people pay a lot of attention to heart, brain, kidneys, and lungs, but nobody talks about the liver. And the liver is the organ which is the most important in my opinion. Liver is the one which detoxify everything and anything, the junk we put it into our body. Second, it eliminates all those toxins which are produced by our body or we ingest. And third is it everything which is in the blood, proteins, enzymes, chemical, liver has something to do with it. Liver is very, very important. So we could divide liver function test into synthetic function, where it makes all those things which are necessary for us to live. Number two is the excretory functions, where it dumps all the bad stuff. And third is the uh, what we're detoxifying, where the junk which we put it in, it detoxify. The liver is made up of cells, And those cells, if there is anything wrong with them, these two tests, alkaline phosphatase and AST, these are the two tests which are predominantly involved if you are taking anything which affects the functioning of this liver. If you will see if you're taking a lot of Tylenol, or you, God forbid, you have any kind of hepatitis or any kind of problem which involves or destroys the cells of the liver, you will see alkaline phosphatase. I'm sorry, apologize. Al- alanine aminotransferase, ALT and AST, they will go up. Then, whatever these liver cells produce or detoxify, they are taken by small canals and then eventually dumped into the common biliary system to be excreted through the gut. Those tests are the one which we call alkaline phosphatase, bilirubin. These are the bilirubin is the end product of the hemoglobin when it gets destroyed and eventually used up and produced and thrown into our in your gut. The yellow color in the stools which we have, that comes from bilirubin. You might have seen a jaundiced patient when their bilirubin goes up, their eyes become yellow, their skin becomes yellow. That comes from here. Then remember we talked about a lot of proteins which it make. All the when you all the proteins which holds blood in the circulation, all the coagulation proteins, all the chemicals, enzymes, all these things are made by the liver, and we could measure them. How much is the total protein in your liver? Then specialized albumin, globulin, and the ratio. That's what the liver test is. So see the liver through the lens of three things. A, through these liver cells, which will be ALT and AST. If there is some problem or what you're doing affecting your liver cells, that's ALT, ALT. And then the conducting system, whatever liver produces before it gets dumped into gut, if anything is wrong, you will see alkaline phosphatase. And then bilirubin is the one which tells what's going on with the synthetic or detoxifying feature of your liver. And then if your liver is not producing, then you will see your total protein, albumin, globulin will go down. You might have seen people who have ascites, sorry, people who have cirrhosis, they have this big bellies, legs are swollen. Those are the people because liver has quit producing these proteins and they cannot hold the things in circulation. So liver is very, very important organ, and we must take care of it. So whenever you are trying to interpret your liver function test at home, just look at into three things: the ALT/AST level, how much is the alkaline phosphatase and bilirubin. That will give you some directions. Next is your lipid profile. See the cholesterol. When we talk about lipid profile, we are talking about cholesterol. This is where I end up spending, if I spend 15 minutes in a visit when you come for follow for your blood test, usually this discussion involves more than half of the time. And you need clarification here. Cholesterol is not bad. Cholesterol is uh, very, very important. Anything which is happening in your body, cholesterol is involved. First of all, every cell member in your body is made up of cholesterol. It provides the building block of each cell. Then inside the cell, lot of hormones, chemicals, you need cholesterol. Next myth is cholesterol comes into the body from two sources. One, what you eat, and second, what your liver produces. Definitely, if you eat food which is too much in your cholesterol level will go up. There's no question on that one part. Second source is if you have a liver problem, Cholesterol is made by the liver. If you have a genetic disorders where there is a problem, then this the second source of this thing. And third thing is you might have heard your doctor telling you stop cakes, cookies, candies, soda. I think that's the biggest offender. The simple sugar, the theme behind is simple sugars. So normally your cholesterol enter into the body based on what you eat from your diet. Second, your liver produces normally cholesterol, and your liver produces more cholesterol than what you eat. But there is a big, beautiful balance based on that, how much you need, because liver is very important organ and it has breaks and systems how much it can produce it. If you need your cells need more cholesterol for hormone production or for repair of cell membrane and other thing, your liver can produce more cholesterol. But what happens with your diet? If you keep on producing too much, yeah, keep on eating too much of cholesterol, you could overwhelm the system. Your experience might be that once you are on a keto diet or any diet for a short, I'm not recommending any kind of a diet because the balance lies in the middle, and the balanced diet is the only way you should eat. But I'm just trying to explain you to this point that short term, if you go on a keto diet, suddenly you find your total cholesterol decreases, your good cholesterol improve, and your bad cholesterol is improved, is gone down. What is going on there? The key between your amount of cholesterol you are ingesting and how much your liver produce is the insulin level. Once you eat a food which is highly processed and leads to significant spikes of insulin whole day, like which you will see is whole day. The people I've seen everywhere, people are sipping soda. So this means they are keeping their insulin being produced all the time. Once the insulin is produced, your body or through insulin, you're telling your liver has produced these lipoproteins, which I'm going to describe, which lipoproteins are the one which pick up this cholesterol. They are the delivery trucks. They pick up this cholesterol and take it to the different parts of the body where it's needed. Those, once you have higher insulin, liver stops sending the cholesterol where it needs to go for repair and function, but it prioritizes your glucose to be taken up, and then your these trucks bigger or the cargo on these trucks gets oxidized, and that is the one which gives you plaques. Now, lipoproteins. Liver, the way liver transport when the cholesterol is made, it has to be transported into different parts of the body. These lipo and liver coats them with protein, and the final product is called lipoprotein. And there are different names. VLDL is the first one which is produced, which has a protein, apoprotein B. Then, when it's thrown into the circulation, when some out of cholesterol is used somewhere and rest, like a truck going to one place, some is used out of it, and truck is half empty, then we call it IDL. Then, when more is taken out, then is called LDL. So the journey is from VLDL to IDL to LDL cholesterol. If you ever have seen your blood work, this is the one most of the time your doctor will talk about LDL cholesterol, because this is the one which is used after it has delivered. When wherever the cholesterol needs to be used, whatever is left behind on the truck, this is the one LDL cholesterol is. And if your truck is loaded with cholesterol, now when it gets oxidized, that is where the problem comes in. It becomes sticky and it makes plaque. It's not as simple as I'm describing, but that will give you the essence. HDL cholesterol is the second delivery truck. They are your month, week. You might have seen we have municipal committee people come in with the trucks. They take away our junk and take our trash. Whatever this trash is taken up by this HDL cholesterol. But the bad part is the service of HDL cholesterol depends on how much triglycerides are circulating in your blood, how much you exercise, what kind of diet you eat, how much um, genetic this you are predisposed to the level of this thing. We have a lot of things which we could do with medicine to lower your total cholesterol, your triglycerides, and LDL cholesterol. All the medication to improve your HDL. This is the one which is going to save you HDL cholesterol. HDL cholesterol goes up only with the lifestyle, which is eat balanced food, not high protein diet or anything. Middle, everything in life is in the middle. Second, 30 minutes exercise, moderate intensity, 7 days a week. Third, do not smoke because if you are smoker, this HDL cholesterol will never come up. You could do anything. So problem will happen in smokers is you with the medication you may lower your bad cholesterol or LDL cholesterol, but because your HDL cholesterol will be so low, the ratio of good and bad will be very very low. This is the cholesterol profile of my dad, and see he was 89. Even at 89 his total cholesterol was 100 and 100 without any medication. His LDL cholesterol, which is the bad cholesterol, was only 37, and good cholesterol is 40, 49. And I think he never took any medication. And I truly believe the reason he had such a beautiful life was because he had a very clean life and he basically lived the spirit of what I've been trying to explain so far. Cholesterol, in nutshell, you think of it has two sources. One, what you eat. Second, how much your liver produces. Liver produces more cholesterol than what you eat. But how the delivery trucks are going to take away and what is left on the truck depends on your carbohydrate load, what kind of carbohydrate and how much insulin is in your body. If your too much is left on your delivery truck, it's going to get spoiled, rotten. In case chemically, we call it oxidized, and oxidized LDL cholesterol is a site which becomes sticky and make plaques, block up arteries, and give us heart attack, stroke, and this thing. I know this needs to be really clearly understood. So LDL cholesterol is your bad cholesterol. Technically, on the delivery truck, this is the extra which has no place to go and is rotting there. And your HDL cholesterol is the one which is the cleaner. I hope these analogies help you and you find it out. These are the 7, 8 myths which I want you to be very, very clear. High cholesterol equal to high body weight only is false. I just not told you your cholesterol, your liver makes more cholesterol than this. It is more intricate than that. All cholesterol is not bad. HDL cholesterol is helpful. Only older adults needs to worry of the cholesterol. Absolutely wrong. Younger some people needs to worry more about the cholesterol because they have a long time to get sick and we could prevent a lot of heart attack and stroke. All fats, avoid all fats to control cholesterol. No, your body also makes cholesterol. If a normal weight means normal cholesterol, to some degree that is true. If you have now, if you're not eating excessive cholesterol and your diet is not simple carbohydrates, then your body's internal wisdom, where is controlled by the liver, how much is produced. will take over, and chances are you will have normal cholesterol. If you're in statin, you don't need to have a healthy lifestyle. That's I don't think it needs any explanation. It is wrong. Dietary cholesterol is the main culprit. No, your liver produces cholesterol. You could have some genetic, but most of the time, diet is very, very important. Cholesterol cannot change quickly. Absolutely, the medications are very predictable and they work very quickly. Shifting gear, next pro test is your thyroid profile. Actually, on thyroid profile, I have created a video which is dedicated entirely on the thyroid, and we will link it up. But whenever we check thyroid, you will see three numbers. You will see total T4, total T3, and TSH. TSH is the hormone which is produced by your pituitary gland, which sends signal to your thyroid gland to produce hormone. Body produces primarily T4, and then individual tissues convert this T4 into T3 based on the needs. So I have explained in a long detail regarding this process, but for this discussion, you need look at TSH. If your TSH level is high, this means your thyroid is not producing this T4 and T3. The levels are low, and that condition is called hypothyroidism. Most of the time, it's an autoimmune disease. It could be due to multiple other reasons, but for this discussion, primarily you is a autoimmune disease. So look, if your thyroid is high, TSH is high, this means your thyroid is sending, your pituitary gland is sending a lot of signals, and your thyroid is not responding. So the problem lies with the thyroid. If we reverse it, if your T4 is very, very high, that there are some conditions like Graves' disease, some tumors, some adenomas, where your thyroid gland becomes autonomous. It's not under control of TSH. It's just keep on throwing a lot of T4, and then we can develop the condition which is called thyrotoxicosis. In a normal person, this needs to be within normal range. This needs to be normal range. This normal to be range. If all practical purposes, if on the thyroid profile, look at that TSH. If your TSH is normal, there is a 99% guarantee that you are normal. If your TSH is high, this means your thyroid is not working. Then it's called hypothyroidism. If TSH is low and the TSH is not producing, then it's a whole host of other medical problem. So thyroid is why we test it. Thyroid is the hormone which starts chemical reaction in every cell. If thyroid is not working, you will be feeling very weak, tired, sluggish, sloppy, mental fog. There is not a chemical reaction which does not require thyroid. And if your versus, if your thyroid is more, you will be super active, you will be very anxious, you will be very you have a lot of palpitation, diarrheas. But pay attention to TSH. That's the only thing I want you to remember. It needs to be within normal. In seniors, if your thyroid function is running low, then it can lead to a lot of mental fog, and sometimes it can lead to dementia. That's why you get tested all the time. Next test, we all must pay attention after cholesterol, importance wise, is hemoglobin A1C. Hemoglobin A1C is the one which gives you an idea about your average sugar. When you eat, it gets your blood, your carbohydrate gets converted to glucose, they get into your circulation. And in your circulation, these glucose molecules, they get bound to your hemoglobin in your red blood cell. Remember in the beginning in the RBC section, I told you hemoglobin pigment which carries oxygen. Also, if your sugar gets bound to those hemoglobin molecules, your red blood cells have a life of 120 days. So that's why whenever you have a hemoglobin A1C, it gives you a insight of your eating pattern in last 120 days. If you check your sugar now, it give you this your sugar level here and now, but it will not tell you what you're doing on an average basis. You people tend to not pay much attention to this test, but this is the test which will give you an average sugar test. I think this is the snapshot of your dietary pattern. If your normal blood sugar, if your hemoglobin A1C needs to be less than 5.7, and between 5.7 and 6.4, we call it pre-diabetes. And when hemoglobin A1C increases more than 6.5, that is diabetes. So average sugar, with if you look at the charts here, if your hemoglobin A1C is 6, your sugar is 126. Anything above blood sugar consistently more than 126 is a legal definition of diabetes mellitus. So I would say this test everybody should know. And if your A1C is anything more than 5.7, you have a metabolic problem starting. If you back off, you will never see the day of having heart attack and stroke. But if you do not, you will have a problem. There is not a day when we don't get the patients who are totally oblivious. They say, I check sugar now and my sugar was 110, and you're telling me my average sugar was 240. Because I am going by this test that gives me snapshot what's happening in last 3 months. Reverse side is if you start doing something correctly and you come to us, we told you that you have this problem, you change your lifestyle, you start taking medication, you don't your A1C will not change in next 10 days. It will take 120 days. Remember how the blood works? This life cycle of a red blood cell life is 120 days. So if you are bound, whatever sugar is bound, that cell has to die. And the newer cells which are being made, once your average level is low, so they will be less bound and it will take 3 months. And anything which can change the level of red blood cells, that can change your hemoglobin A1C. I've seen, actually, it had happened yesterday. I had a patient who had massive GI bleed. I have seen him 2 days ago before this thing happened, and his hemoglobin A1C was 12. And I explained him his sugar is running about 300. When he went in and they had about 4 units of Bactar basis, and then he requested his physician to get hemoglobin A1Cs for 5.6, and he was debating, and I have to spend 15 minutes explaining him this analogy. So I thought that may be pertinent to explain you about the hemoglobin A1C. Two vitamins, B12 and folic acid, are very important. They are required for the functioning of very important cells in your body. One is your brain cells, nerve cells, red blood cells. And all these cells are the lifeline. If you have a problem with the B12 and folic acid, you will have a lot of nervous system. You could have lot of neuropathy symptoms, numbness, tingliness, and we get lot of patients who have vague symptoms. Most of the time, they have vitamin B12 deficiencies, and B12 primarily comes from animal source. People who are vegetarian, they will have tend to have a lot of B12 deficiencies and a lot of medications which interferes that. We have a lot of videos on B12. Actually, one of the best viewed video on our channel is on B12, and we will link it in the playlist. you should watch it and get yourself more educated. But make sure you get your B12 level checked. It will affect your brain function, nerve cells, and red blood cells. And then in case of males, PSA test, we do it. That something which is very, very controversial. Unless you have a family history of prostate cancer and you have Afro American ancestral background, the PSA testing is very debatable. In Caucasians, PSA test has been a lot of source of problems. What was happening is PSA test A goes up high with the normal age. And if you biopsy everybody above the age of 80, there is significant proportion of people who have prostate cancer and they never have a symptom. It is a very slow growing tumor, but cancer is a cancer. If somebody gets diagnosed with any kind of cancer, even though you know that it will never hurt, it plays on your mind. So that's why the guidelines on PSA test keep on changing. As we stand, current guidelines are if you want it and if you're symptomatic, we will order it. But this is not a test which is automatically ordered. If you're a Caucasian male and you have no family history of prostate cancer, I tend to follow United States Preventive Task Forces. We will discuss with you, we will know what you think, what your belief system is, but it will not be offered to you automatically, but we will have a discussion. But if you are at high risk to develop it, we will order it for you. And last test is the urine test. On the urine test, when we are doing normally, we are looking for the markers of inflammation and kidney function. It is not for looking for infections when we normally do that. It's uh, it's something which we will uh, check it and we will go for that. My goal in this video was to take you through your journey of common blood test and make them understand the significance. CBC test give you insight into your bone marrow function, your nutritional status, and different organ systems. RBCs are your lifeline, white blood cells is your army, and platelets are your medics. On your chemistry profile, we learned electrolytes tell you about the fluid and balance system, nerve conduction system, and acid base balance. Kidney function is the master gland which controls not only what we filter, it produces a hormone which goes and help you to produce more red blood cells and whole host of acid base balance. And then liver has three functions: synthetic, detoxifying, and excretory. We went over your cholesterol in detail, hemoglobin A1C, and PSA test. I hope this was helpful. Thank you very much for joining us. I have one request: if you could like, share, and subscribe. But most important, please, is to comment, because once you comment on this thing, it kind of gives me insight. And I have to thank two of my patients. I don't have their permission from them to mention their names, but they are the one who are very big supporter of our channel, and they requested me last week when I came back from India to make this YouTube live session so that they could understand the lab tests. We will continue to produce the content similar to that. Please do comment, like, share, and subscribe. And thank you very much. And I will see you in next.